untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: what precautions should we take before using antacids for treating gastroesophageal reflux? Answer by Maria Ritaza. GERD is a relatively common disorder that can be easy or very difficult to treat. Usually affected individuals will start out with neutralizing antacids such as Tums or Rolaids, but their actions are usually short-lived and ineffective in the long term. That being said, these types of antacids are relatively benign as far as long-term use goes. Another type of antacid is the H2 blockers, like Pepcid, Famotidine, Zantac, ranitidine, etc. Though they also reduce acid in the stomach like neutralizing antacids, H2 blockers are much more effective and long-lasting and have a completely different mechanism of action. They work by blocking gastric acid secretion, whereas neutralizing antacids act to neutralize the acid already present in the stomach. H2 blockers are also relatively benign to use long-term, but some refractory cases of GERD do not respond to this therapy. Many people with GERD respond well to proton pump inhibitors, PPIs, such as Prilosec, Omeprazole, Protonix, Pantoprazole, Nexium, Esomeprazole, etc. They are very effective. However, it may take 24 hours to feel relief of symptoms. PPIs work by blocking gastric acid production and are significantly more effective than H2 blockers in most people. PPIs have been widely used by many patients since their appearance on the market, but studies are now showing that long-term use of PPIs can result in decreased bone density, pneumonia, and gut infections such as C. diphthalitis, and infectious gastroenteritis. With any type of GERD, it is important to rule out any possible comorbidities or disorders that can feel like or complicate GERD. In many cases that are refractory to H2 blocker and or PPI treatment, you'll need to be assessed by a gastroenterologist for a barium swallow, upper endoscopy, pH testing, and manometry for further evaluation. There are also a number of procedures that have been developed to manage GERD, such as laparoscopic fundoplication, traditionally the gold standard, the Stretto procedure, transoral incisionless fundoplication, TIF, and the LINX. Laparoscopic fundoplication, to my knowledge, has been the most effective but is also the most invasive, despite its laparoscopic nature. Also, a main complaint people have about lap fundoplication is the inability to burp. The other procedures have resulted in mixed outcomes. For instance, some people have found relief from one round of Stretta, whereas others have had to undergo 2 rounds to find relief. LINX is a relatively newer procedure and has had mixed reviews.